This patient was referred to us by her primary care physician for weight management. She's a 41-year-old mother of two whose current weight is 178 pounds. At 5 feet 6 inches with a BMI of 28.9, she is considered overweight. The patient reports struggling with her weight for about 20 years. She was physically active in high school, but reports that all physical activity stopped when she entered college and she gained 20 pounds. She states she has attempted diet since then, but has not been successful. At age 21, she weighed 140 pounds, so her percent weight change is 21.7% gain. Her typical 24-hour diet included a cappuccino or latte first thing in the morning, followed by a donut and 2% milk. For lunch, she reported a peanut butter and jelly sandwich and a piece of fruit, along with an afternoon snack that included cookies and milk. Her dinner typically consists of a hamburger or chicken, some variety of potato, corn or peas, and a green salad with ranch dressing, and ice cream or jello for dessert. She typically drinks water with dinner and has an evening snack that consists of chips and dip along with a glass of juice. The patient didn't offer any portion sizes for her meals. Her notable lab values included A1C of 5.1%, which is in the normal range. This is important because it indicates she is not pre-diabetic or diabetic. Her fasting blood glucose was 126 milligrams per deciliters, which is on the high side. The normal range is 70 to 110 milligrams per deciliter, but she is not elevated enough to be considered hyperglycemic. Her A1C and blood glucose levels should be monitored. Another concern in the patient's lab values is her triglyceride level, which is 189 milligrams per deciliter. The target is below 150. Along with elevated triglycerides, her HDL levels are low, her LDL levels are high, and her total cholesterol is at 193, which isn't above the normal range, but all of these are indicators for cardiovascular disease, so we should keep an eye on all of them. Lastly, I also included her blood pressure, which was 140 over 90. This is relatively high, and it's also a risk factor for cardiovascular disease. After finding her resting energy expenditure, I used the Mifflin-St. Jeor equation to calculate her energy needs, using the activity factor 1.2 since she reports little to no physical activity. I would recommend a caloric intake of 1,789 kilocalories per day. I also estimated her protein intake at 46.8 grams per day and her fluid intake at 2,400 milliliters per day. The nutrition diagnosis is overweight related to lack of physical activity and consumption of excessive calories, as evidenced by 27.1% weight gain. The intervention will include motivation through goal setting and the trans-theoretical or stages of change model to assess the patient's feeling for need for change. We'll monitor using weight and 24-hour recall as indicators for success. And the goals are 7% or 12.5 pounds weight loss over the course of 7 weeks, as well as cooking 2 dinners per week that meet the MyPlate recommendations, and then gradually increasing those.